Good morning, everyone. My name's Penny Curtis. I work in the mental health unit in the Scottish Government. What I'm going to talk fairly briefly about is the consultation exercise that we're 2 months into now on a new mental health strategy for Scotland. So I'll talk a little bit about the approach we've been taking over the past few years, and then a little bit about what it is we're trying to achieve through this consultation exercise. So, to kick off, we've set out here 3 things that encompass what it is we've been trying to achieve over the past few years. And the first of those is to encourage a change in the way in which we all think about our own mental health. The second one is to ensure that mental health services are person-centred, safe and effective. And then finally, that we're embedding a culture of continuous improvement into the delivery of mental health services. And that has been set out in 2 main documents, which have been separate up till now, which is the one around mental health improvement and preventing mental illness, and that's set out in Towards a Mentally Flourishing Scotland, TAMPS, and the other one around improving mental health services, which we set out in Delivering for Mental Health. Both of those have pretty much reached the end of their timescales, their lives, and what we've got now is an opportunity to start to bring those 2 agendas together. We know that we can't look at treatment and care for mental illness without looking at what it is you would do to improve general mental health and well-being and to prevent mental illness. So what we're trying to do is to bring these 3 elements together within the one strategy. So this is our first attempt at doing that. I don't think what we've got in the consultation is everything we'll have in the final strategy, but it's where we're starting from. And I think the other thing to pick up with this, why we're integrating it, is it's reflecting where local areas have got to as well in terms of how they're designing their services and the strategies they're taking, exactly the stuff that was coming out in the earlier presentations around what's happening in Perth and Kinross. So, in the consultation exercise, what we're not saying is it's a completely blank sheet of paper. It's not. We're on a journey at the moment where we've been looking at service improvement over a number of years. And broadly, when we're talking to our partners about the changes we're trying to make, particularly in the service delivery agenda, people are broadly saying, yep, we don't want a big change of direction. We want to build on the improvements we've made and see where we can take that over the next 3 to 4 years. So we've identified 4 areas where they're almost givens. They're things that, regardless of what else comes out in the consultation, these are going to be 4 of the big strands that we're using to continue to develop the agenda over the next 3 to 4 years. And there's slightly different reasons why we've picked these 4. The first one is around psychological therapies, access to psychological therapies. We have a heat target at the moment, which is one of the big kind of drivers within the health service. But this target gives us more than just faster access to psychological therapies. In order to deliver faster access to psychological therapies, you can't deliver that in isolation. What you need to have is actually a very well-functioning mental health system, and not just within the health service. It actually goes much wider than that. You need to have the prevention work going on. You need to have the low-intensity, high-volume interventions where people are experiencing mental distress. They don't have a mental illness or disorder, but there is probably something they need that will be helpful to them. So without that, we can't deliver faster access to psychological therapies for those people who do need them. So what we get with that target is quite a lot around a good, well-functioning mental health system. So we know that's going to be one of our key drivers over the next 3 to 4 years. The next one, which again you'll have heard a little bit about this morning, is the National Dementia Strategy. We don't talk about it very much within this document, looking at the mental health strategy, we published Scotland's first dementia strategy just over a year ago. And we're making quite a lot of progress on that. We know that is going to continue to be a huge priority as a result of the changing demographics. We know the number of people with dementia is going to double in the next 20 years. A lot of the focus around the dementia strategy has been looking at how we improve how general health settings respond to the needs of people with dementia, and also looking at what support, care, information goes on to help people and their families, particularly in that period immediately after someone's diagnosed. And that's going to continue to be a priority. The next one's a little bit different, the balance between community, inpatient and crisis services. One of the things we've been quite successful with over the past few years is to really improve the amount of information we have about mental health services. I don't think we've got good information about outcomes yet, but we certainly have good information about what's going on across different health board areas. In some areas we can look at council areas. What we want to do is to start and build on that information we've got, the benchmarking data, to try and understand what is it about the structure of services that gives us the best outcomes. So what is the right balance between community services and inpatient services, and what's the role of crisis services within that? We don't know exactly how we're going to do that work, but that's something we're going to start to do. And probably what we'll uncover is a lot of questions beneath the data we've got. That's okay, it's the start of a process. And then the last one we've identified as one of the big drivers for us is preventing suicide. Again, there's an existing HEAT target to reduce the level of suicide in Scotland. We've been on a gradual downward trend. We're looking to see whether or not that changes as a result of some of the bigger things going on around us about the economic climate and so on. But we know that preventing suicide, there are things that services can do to make a difference. We know that diagnosing, recognising, responding to depression, so what goes on in primary care, really makes a difference. We know that dealing with alcohol misuse, again, big difference. We know that discharge planning from hospital makes a really big difference in there. And there's also been a lot of activity across the NHS, across local authorities, across the third sector in terms of training frontline staff in suicide prevention. All of those have an evidence base in preventing the level of suicide. So that's another key driver in how we develop our services. What we're trying to do in the strategy, and we're looking for a kind of time scale of about what can we achieve in the next 3 to 4 years. We're not going to try and change the world. But what we're looking to find are those key areas where if we concentrate on those over the next 3 to 4 years, we'll be able to make a measurable difference and move us on to a point where we can then decide how do we build on that in the next 3 to 4 years. And that's something that Michael Matheson, who's the Minister for Public Health, he's responsible for the mental health portfolio. And he's been very clear that's what he wants, something that we can make a measurable difference on, and a realistic one as well. So what we've tried to set out in the consultation document is the approach we've been taking to support improvement and the kind of challenges we're all facing in making those changes. And we've come up with probably 3 main challenges or things we know we're going to have to tackle. And the first kind of challenge is, it's a challenge of implementation. We know what it is we're trying to do. We probably know what it is we have to do, but there are challenges, there are barriers in the way to implementing those changes. So one example of that we've got there is the dementia strategy. We know the kinds of things we have to do. They're quite difficult to do. So we're looking for what kind of support is it we need to put in nationally that helps people locally make those changes. Another example would be actually improving access to psychological therapies. We know actually what most of the barriers are to that. They're quite tricky ones to get through. Again, how can we support that best from the Scottish Government and the other organisations we work with? So we've got implementation challenges. The other challenge, which is probably a trickier one, is we know there's something we want to change. We know we want to improve how services are provided, or there's maybe a gap in service provision, but we don't know exactly what changes it is we need to make that better. I've identified a couple here. You've probably got one sitting there right now about areas where you think, actually, there's an unmet need there. We need to do something about it. The couple we know are already going to be things we'll work on are around developmental disorders, so ADHD, autism for adults, or trauma-aware services. Another one I think I'd pick out as a key one is older people's services, so things like psychological interventions for older people. Again, we know big service gap there. And then the third thing we're just playing in here is we all know what the financial climate is. We've got reducing budgets. So what we're looking to do is to find out what is it we can do to deliver better outcomes for the same or for less resource? And where can we find things where we can save money without impacting negatively on clinical outcomes? So really, really, really tricky things to do. But we actually have ideas of where we can do that, and we're going to be doing some specific work through the National Consultation event to try and identify some of those areas where we can save money within mental health services in Scotland. So it's not without hope, but we know it's challenging. So the document itself, we've set it out under 14 high-level outcomes, and we ask a few kind of generic questions. Is the structure of that strategy right? Are they the right outcomes? We think they're okay. I'm sure they could be better. We're not absolutely wedded to them, but it's something that's allowed us a bit of a framework to work around. Are there any gaps in the key challenges we've identified? And what other actions, apart from what we've already identified in the document, anything else we should be prioritising nationally to meet some of the challenges out there? We're being quite realistic. We can't do everything. We do have to prioritise. But have we missed anything? I'm not going to go through all 4 outcomes. It would take forever. I've just picked out a few I'm going to talk about very briefly, and ones you may find more or less interesting. The first one, people and communities act to protect and promote their mental health, reduce the likelihood that they will become unwell. So this is what was the Towards a Mentally Flourishing Scotland. This is the kind of key outcome that we're trying to get ideas from people about what do we do with that agenda next. The other kinds of things we focus on under this outcome are around reducing suicide and self-harm. The other thing we'd pick up in here is around stigma and discrimination, especially within services actually, and I think that's probably where we'll be looking to focus some of the work around stigma and discrimination over the next 2 to 3 years. The second outcome, and I do promise I'm not going through these, all of them, is the one where we're specifically looking on early years and childhood. So picking up on the CAMS agenda and how is it that we improve both the short-term and the long-term outcomes for children, young people and their families. The kind of key things we'd pick up on here are continuing to deliver the access target for access to specialist child and adolescent mental health services, building on the improvements we've made to the children, young people mental health services to the workforce, and work looking at how we develop the inpatient estate, or continue to develop that, and how that's supported within the community. Areas we'd be looking at in particular would be around parenting. So some of the evidence-based programs for the kind of triple P, Incredible Years programs, for working with children with disruptive behaviour disorder, 3 and 4-year-olds. So that's something we already know we want to do something with. And then the next one we're looking at, people have an understanding of their own mental health, and if they're not well, they take appropriate action themselves, or they look to get help elsewhere. So we're asking questions here about how do we help people to take ownership of their own mental health? What else is it we should be doing to support that? And what would help encourage people to seek help? So some nice questions to work with there. Okay, skipping on a few. The reach of mental health services improved to give better access to minority and high-risk groups and those who might not otherwise access services. So what we're doing is recognising that there can be barriers in the way for some people to access services when they need them. There probably is unmet need out there, and that could be as a result of, could be gender. For example, men being less willing to go to the doctor when they've got a problem. It could be around ethnicity, it could be around age. So we're asking questions about barriers and unmet need. And then skipping on a bit more, we pick up the role of the workforce that has the skills and knowledge to undertake its job. And it displays the appropriate behaviours and attitudes. We've done quite a bit of work around the mental health workforce, the 3 Rs, agenda for the nursing workforce, realising potential for allied health professionals. We know that some of the big challenges coming up for us will be around dementia and the workforce. Again, that's something where there's already quite a lot of work going into there. Delivering psychological therapies, big challenges for the workforce and how we develop the capacity to deliver faster and more access to psychological therapies. Are there other priorities we should be looking at in terms of workforce development? And then this is picking up on the information one that's come up this morning already. How do we know that our mental health system as a whole is functioning using national data, local data, and really importantly, outcome data? How do we get that information? And we do have a lot of information that we collect nationally. You'll have even more locally. How do we get that into a format that means it's easy to use? You can analyse it. It's presented as nice pictures instead of horrible tables in kind of incomprehensible ways. So people genuinely do use it to look at how effective their services are, to look at it in terms of redesign. We know with the psychological therapies, heat target, one of the areas we think is a really big win for us is if we can get clinical outcomes data used routinely by people delivering psychological therapies. So we know where people are making a difference, what's effective and what's not effective, who are the right people to be going into those services in the first place. And then I think I'd raise a question here because I'd be really interested for your views on it, is how can we do that within the mental health promotion and prevention of mental illness agenda? We've got really quite good information now about services. How do we develop that into the broader world? This is the last specific outcome I'm going to look at in here. So the process of improvement is supported across all health and social care settings in the knowledge that change is complex, challenging, it requires leadership, expertise, and investment. So in this, what we're trying to do is pick up some of the issues around how do we deliver more of the same for less. How do we use some of the levers we've got around, for example, heat targets? How do we use them to get into the wider service structure, so beyond the health service? Because we know we need services working in an integrated way to deliver those. And then I'm just going to finish by putting this up. This is a document that was published in April this year, where a number of people looked at what is the evidence base around mental health promotion and mental illness prevention? And then for those things that actually have an evidence base, what's the economic case? So if we spend £1 on something, what do we get back, either to the health service, to the wider public sector, or indeed to the wider economy? You can Google this, it'll come up. It's a Department of Health publication. What it is is a graph that was published in 2008 by a bit of work done in the King's Fund. Again, look, it's English data. And what they did in this work was look at the incidence of the 8 biggest mental illnesses or mental disorders. And they looked at how much it's costing us back in 2007. And then they went and did a prediction of, based simply on changes to the population, how much are those same disorders going to cost us by 2026? So they've made no assumptions for how successful we would be at preventing mental illness or about any other changes. What they've just done is look at this in terms of population change. Really, really significant increases in spending, quite frightening increases in spending. So this subsequent bit of work looked at some of the things that we have an evidence base for and what is it that's effective at preventing mental illness or improving mental illness, and what are the ones that are going to give us the biggest economic payback. But some of the things it picks up in here are really quite striking. One or two I'd want to pick up in particular because they're the ones we're really interested to look at. I talked about early intervention for conduct disorder, so what you can do in terms of the evidence-based parenting programs for 3 to 4-year-olds. That's one. Spend £1 in there, you get about £8 back across the whole economy. Some of the other ones, early detection and early intervention for psychosis, that's one where you genuinely can make a difference to either how severe the illness is and indeed in preventing illness. Again, some really big paybacks. One of the ones that we've really picked up on, because it's one, most of these we're probably doing something on, not necessarily through mental health services, it could be other bits of the public sector, but one that really struck us, prevention of conduct disorder through social and emotional learning programs. So not what's going on in mental health services, what's probably going on in schools, early years settings. Put in £1 there, £83.73 back. Absolutely huge economic payback. So you can bet that's something we're really interested in looking at. The role of debt is probably another one, and debt advice services and the impact they have. Not the big numbers, but given where we are within the kind of economic cycle or unprecedented economic situation, I think one we'd certainly want to pick up on as well. So, bit of food for thought there. Next steps, we're consulting on the strategy until the end of January. We quite deliberately had quite a long consultation period in there. We'll be holding a single national event in December. Flyers for that are out at the moment. We'll actually be webcasting it as well because we realise not everyone will be able to make it and not everyone will be able to fit into the venue. After that, we've got a bit of work to do, analyse those consultation responses and then develop a final strategy which effectively sets out what it is we're going to do over the next 3 to 4 years. It'll be measurable, and we want realistic actions or commitments of things we want to see change over that period. And then just to finish, the web address and the email address for how you can get in touch with us. So thank you very much.